Good morning, everyone. My name is Julie Villa. I'm with the California Rural Indian Health Board and the ACORNS and CITE program. I would like to go over just a little bit of housekeeping for some upcoming projects that we have going on. One of them being the Project Sun. This is a facilitator training that's going to happen here at Crib 1020 Sundown Way in Roseville, California, Thursday, August 16th from 9 a.m. to 4 p.m. And this is a curriculum that's very specific for American Indian teens in a commercial tobacco cessation program. For this particular training right here, we also have some travel scholarships. So if you have any questions, you can please call me, jvia@crihb.org. Our next one is going to be a grant writing training. This one is going to be located at Redwood Valley Rancheria Education Center, Building B, 3250 Road I, Redwood Valley, California. This is right off the 101. So many of you know about this already. If you have any questions about that, you can also contact me to RSVP. Our next training that we have coming up is our California C4, Creating Community Circles for Change. This one is going to happen September 12th through the 14th. This one is going to be basically strengthening your facilitation skills, elevating your knowledge on cancer prevention strategies, learning how to integrate culture as a resilience factor, sharing what works with best practices. This one is going to be located at the Canocti Vista Casino. If you have any questions in regard to this one as well, you may contact Miss Jamali Austin, gaustin@lcthc.org, or you can reach her at 707-263-8382, and she is at extension 1601. Again, that is for the California C4, Creating Community Circles for Change, Miss Jamali Austin. A couple more, we are going to have a couple more TA sessions for the ACORNS and CITE application. Our next one is going to be on the 15th, then again on the 22nd, and the final TA for that is going to be on the 29th of August. Applications are due to us September 4th, and then our next session of evaluations is going to be on the 16th, and then again on the 23rd. We also have a new grant writer here at Crib. Her name is Miss Carol Madam. If you have any questions that are grant specific, or you have any need assistance in writing your grant, you may contact her at cmaytum, M-A-Y-T-U-M, @crihb.org, or you can reach her at 916-929-9761, extension 1104. So our next presentation is going to be by Mr. Michael Mudgett. Michael Mudgett is an enrolled member of the Spirit Lake Dakota Nation in North Dakota. He is also Mandan and Chippewa from his maternal lineage. Michael is an epidemiologist working with the California Tribal Epidemiology Center, the CITE Center here at Crib. He's completed a master's degree in public health from the University of North Dakota at UND. Michael was able to gain valuable research experience working for the Center for Rural Health as well as the National Resource Center on Native American Aging, both located within the School of Medicine and Health Sciences. And in his current role, Michael collects, organizes, and interprets data within CITE in order to better understand, address, and improve American Indian Alaska Native health throughout California. So I'd like to present Michael Mudgett.
Thanks, Julie. Hi, everybody. My name is Michael Mudgett. Thanks for that awesome introduction, Julie. I am an epidemiologist here at the California Tribal Epidemiology Center, which is housed within Crib. So some of you may know me more than others. I work as a technical assistance provider for the ACORNS program in the subcontractors where their needs may meet my expertise. So if you can see my screen, today I'm going to be going over a part 2 of a 4 series of this series of introduction to evaluation. Eugene did the part 1, and I'm doing the part 2, which is data management. So his part 1 was the data collection tools and instruments to collect your data. Data management now is how you house that data properly, and ensure quality of that data while you're housing it and cleaning it. So it'll be mostly a primer for part 3, which I'm also doing, is data analysis. And then Eugene will follow up on the last part, part 4, which will be reporting and other things of that nature. So let's go over the introduction of what we're going to be doing today. So we're going to be discussing some of the basic tenets of data management. That includes data collection techniques.
I can't see it. Hey, Michael, I can't see your presentation.
Oh, Eugene can't see the presentation. Thanks, Eugene. Can you see it now?
I can see it now.
Okay.
You just need to full screen it.
So are you good now? Can you see the presentation? Yeah.
It's in your presentation mode. It's not in
Oh, it's a presentation. Okay, I see.
So go double click on that and enlarge the screen back.
Oh, here we go.
So minimize your presentation.
Wait, this is what they'll see, I think. Here we go. Eugene, does that look fine?
So that's actually a presenter view. You want?
Oh, they're not seeing that one.
They don't see it at all. They only see us.
Yeah, I just see the. You want to just click the presentation mode on the bottom. Like go to.
See, that is usually down here across the bottom.
Next to the magnify and minimum, like the zoom in and out function on the orange bar. There's a presentation button. You want to click that?
Can you just come over here?
Yeah.
All right, so we'll keep going. Display, switch. All right. So just to reiterate what we're doing, so we're going to be gathering what I talked about, talking about gathering key information, data collection techniques, talk a bit about survey data and sampling, which are basic concepts that I wanted to go over, at least in brief, in managing collecting data as well as ensuring its quality while it's being managed. Each of these sections sort of has its own, you could go into a master's or a doctorate program for like research methodologies and statistics, for which you can learn so much more, but we'll briefly talk about some of the basic tenets of these concepts to better help you manage some of the data that you have within your own programs. We're going to review some survey results, and then we're also going to talk about some last minute recommendations and considerations. So gathering key information, we're going to work on selecting the appropriate data collection instrument. We're going to work on using getting the appropriate tool for your needs. Eugene had gone over in webinar 1 sort of the basic tenets of identifying the tools you'll need appropriately for collecting your data. So you can review that if you need more information on data collection instruments. We're going to when talking about data collection instruments, those can be things that are existing. They can be things that you modify for your needs, or they're things that you newly create, and that depends on, again, your needs. And that's not totally unheard of for new data collection tools to be created or modified for its use in Indian country. Now, we've modified surveys at CITE all the time to be more culturally appropriate, because we might know a little bit more about the communities we serve, and we would get direct input from them about some tools that we use to collect data. So we would modify those tools. One example is we are collecting behavioral risk factor surveys, which is a CDC tool that we've modified to be more culturally appropriate for the American Indians throughout California. That's one example of a modified tool. An example of a newly created tool would be researchers have created a cultural connectedness scale to measure your connection to your culture from American Indian perspective. That would be a newly collected tool, for example. Now, so basically these all lead to, answering information that you have about important questions. Your survey might ask, what is the importance of a new clinic to our community? That would be maybe a needs assessment, or getting feedback on implementing an intervention for maybe a weight loss intervention. You might want to get people's perspectives on that, or you might want to collect demographic data on their weight and health, related behaviors or outcomes to maybe justify that intervention. There could be serious consequences to not collecting and managing and storing data appropriately. You could be unable to answer some of your more important questions that it was intended to answer. You might run into the issue of not being able to repeat that study or that survey again. And ultimately, worst case scenario, obviously, you might do more harm if used to inform decision making based on bad data, or you stored the data inappropriately. Certain people had access to it, edited it, or maybe it was just stored in a way that, now that when you analyze the data and, provide recommendations to like your council or to, officials for policy interventions and what have you, those could be used, to make decisions, and you want the best data to make the best decisions. So briefly, data collection techniques, you can use a variety of techniques to collect your data: interviews, questionnaires, surveys, focus groups, case studies, which can involve storytelling and oral histories, which can be very important in some of our communities. We have really rich oral histories in a lot of American Indian communities, as well as storytelling. Those can be methods of data, points of data that are important. And you can also have documents and records. Maybe those are historical records, enrollment data going back to the early days of enrollment, if that's a need you have. But it all leads to this idea that data collection is basically about collecting information for a purpose. And all of these techniques have their purpose depending on your need. Here you have a key informant interview, for example, and these are just questions that you would ask someone who's given you information, say, in a smaller group. If you can look at the survey, and I apologize if it's hard to see, but the survey basically talks about the general perceptions of local healthcare. These people wanted to know what the perceptions of people were on the healthcare, so that they have leading questions that the the person conducting the focus group or the interview is going to ask hospital perceptions. What do you think of, for example, the quality of care, and they'll get the feedback. That's more quality data, so it's like a qualitative approach to collecting data. Whereas, for example, many of you are familiar with survey data, which is more of a quantitative approach. You're getting a quantity, a certain amount. You're hoping to get more and more data that represents your community, or for which you're trying to represent. Maybe it's a program, people who use a program. So you want quantity in that, so you can get a lot of demographic information like age and race and sex. If it's, in this one it says, what grade are you in? It's a youth survey. Or maybe you're trying to represent middle schoolers in your community and what have you. That, for this purpose, a survey would be more suited. So collecting survey data, there's a couple methods to do it. These aren't all the methods. I'm sure new methods appear all the time. Basic pen and paper. You can, distribute pen and paper gets the job done face to face. You give it to someone, they take it. You can do online or web-based. That is sort of newer. You know, that's like the SurveyMonkey, the Qualtrics, the online survey where if someone takes it online, the really good part about that, you get a lot more people and you reach a lot more people conveniently. Not everyone will always have access to internet depending on where you live. In some of the communities you live, maybe you have not as easy access to the internet. That can always be a case. We try to do both, but we try to also implement, you know, technological approaches to this. So we offer pen and paper for some of our papers, that our surveys that we gather here at CITE. We do a paper survey, we do an online survey, and we also give them the option to take it on an iPad or a tablet. We have iPads that when we're in the field collecting data, we program the iPad to, so if you select no, say, or if you select you're a male, you'll never get any of the female questions, whereas on a paper, a male could theoretically say they're a male and then answer inadvertently all the female questions. You can mitigate that on the iPad or on a tablet or online using skip logic, branch logic, and things like that. And this is all considered primary data collection if you're doing it on your own, which, you know, congratulations, that is one of the tougher ways to analyze data and report data is when you have to collect it yourself. Other data sources like the CDC, state data, county data, those would be considered secondary data analysis, where you're not using your own data, you're using someone else's data. So after that, well, before that, actually, you're talking about sampling. You have, you know, your approach now. You know, I'm going to do a pen and paper, I'm going to do a tablet, and I'm going to do web link. But who are you going to collect from with that approach? And that's a very important question, because when you talk about sampling, you have to have a strategy that represents the population that your results are going to refer to. If you're just talking about middle schoolers, because of your intervention, your survey questions are talking about intervention results. You know, you want to be able to have those findings, talk about that target population. And your samples are going to be the people who you survey. So you might get, if you have a community of 1,000 people, you might collect 300. Say you collected 300, that could be a good representation of your target population. If you're trying to represent a school, for example, if you get, you know, a good amount of the school from each grade, that could be a decent representation of the school. So it all depends on your sampling technique and what you're willing to give up. You know, it's a give and take. Obviously, the bigger the N, or the, when I say N, I refer to sample size. The bigger the sample size, the better, because, you know, if you collect from 90% of your population, that's going to do a pretty good job of representing your population. When you have your results, 90% of the people in my tribe said that this, and this. No one's going to dispute that. But if you had 8 people in an elder center take your survey, and now you're trying to rationalize those results to the general tribe at a whole, or a community at a whole, it might not go very well. So again, you got to ask yourself, you know, who's this referring to? What population? When you're talking about sampling for your survey or for your data collection needs, different sampling techniques will only refer to certain groups, like I had just mentioned. Again, we're only going to touch over this briefly. Let me know if you have actually more questions about this, because I could go over it in more detail. But so essentially, it's sampling. You have an original sample that you have in mind that you want to collect data from. You know, whether it's through your survey, for example, that it represents a population, which also is sometimes called your sampling frame, which also is a smaller representation of the bigger population at whole. Maybe all American Indians could be the universal population, but for your purpose, your population is the tribal community in your community. But you're going to sample a subset of them to get a good representation of that. And in your sample, you're most likely going to run into loss, non-response, loss to follow-up, and other things. So you might start out with a certain sample size. Your final sample size might be different. So you sort of have to account for those in different ways. There's a lot of ways statistically that people approach those, including non-response, including loss to follow-up. But at the end of the day, it's up to your program to talk about, you know, how you're going to handle those cases if they occur. So a brief question I wanted to ask everyone is, so you say you have a survey that every employee at your travel health program took. So all the employees at travel health took the survey. So it's a good representation of the travel health program, obviously, if everyone took it. So would it be appropriate to report your results like this? 60% of tribal members think there should be more childcare resources. So that's a result of one of the questions asked them about childcare resources. 60% of the people in your survey said, yeah, there should be more childcare resources. But what's the main issue with this question, with the interpretation of this result? Eugene. So the main issue with this is you're saying 60% of tribal members. That's you could probably rationalize it in some ways, but ultimately you shouldn't. Your survey was talking about tribal health program staff. So you could more appropriately say 60% of tribal health program staff think there should be more childcare resources. That would be more appropriate than generalizing into the whole tribe. Maybe there are 80 tribal health program staff, and maybe there are 8,000 tribal members. That's a big difference. So those are little things to consider. So sampling strategy helps. So we talked about sampling strategy, establishing sampling frames, statistical approaches to like non-response, things like that. So those are things that CITE can help you work on if you're in any phase of your project, even if you're working on your ACORNS project or general project after ACORNS. CITE actually is positioned to serve tribes, tribal health programs, and American Indian communities. So even if after ACORNS is up that you want help with coming up with a sampling strategy or anything statistical or data related, we are definitely here to help on that end. So with ACORNS, I would help you because I'm funded to help you. But if it was outside of ACORNS, all of CITE would decide how to help you best. So we're going to talk about managing collected data. I probably can't stress enough how important this step is, especially for me, for example, when I do a lot of work in analyzing data. There's no way we would ever analyze data if it's not managed properly. There are quality issues that we have to take into account, but thankfully we don't really run into that issue too much. The data needs to be stored properly. It needs to be clean, or it needs to be entered. So we'll talk about that in a little bit. So a lot of this might seem so basic for a lot of you, but next week's webinar we'll go into more of the analysis part for which this will build off. So if it seems a little bit basic, I apologize for that, but it's really needed for next week's webinar. And so the data must be entered properly. It must be clean. It could be manipulated and then analyzed. Some of you might wonder, what does cleaning data mean? That's just making sure that the data is reliable to be used. That there's checks in place to make sure that how the person who responded on the survey or whatever data you're collecting, it's managed that way or it's entered that way in the database. Cleaning has a broad array of ways and utilizations. One way you can make sure that your data is clean, among others, making sure that we're going to be talking about an Excel database here, because most people have Excel. So making sure there's no blank spaces in your database. If someone didn't respond, maybe you can decide that's a NA, not available, or no response. That's in Excel. That's very helpful. As one way to ensure some data quality. I have a little example here. If you look here, it says 307. So someone entered that maybe on accident as 307. So that might throw off some of your results if you're looking at what age groups answered a certain way, what age groups have certain health conditions when you're analyzing the data. We'll look at that in the next webinar, but that could be a problem. So data cleaning could be maybe running a frequency count of all the age groups, and something comes up when someone says, hey, 307 doesn't look right. I don't know any 307-year-olds in existence. So that could be something, maybe because we have an ID. If you look at the database, there's an ID. So there's a survey that corresponds to that. Maybe I'll pull that survey up, and at the end of the day it says 37. Okay, now I'll make sure that it's 36. That's That's data cleaning. Sounds simple, it goes a long way. So let's look at our example survey here. And this is what we're going to talk about today. A simple survey, obviously no particular use. I'm just coming up with it as an example, but it asks how old are you? What is your biological sex? Are you affiliated with a tribe or rancheria? Yes, no. If yes, what tribe or rancheria? How much do you weigh without your shoes? How tall are you? Do you smoke cigarettes? Basic questions. So if someone filled this out, so someone is 29, male, yes, tribally affiliated, Cloverdale Rancheria, 177 pounds, 5'10", yes, smoke. If you notice, there's a survey ID that I put at the bottom of there. I think that's just good practice, especially if you're managing the data yourself. It's good that when you enter the data, like I said, that person who was 307, if we didn't have that survey ID, there would be no way for us to go back and clean that. So it's good practice just to make sure you ID all your surveys. It goes a long way as well. So here's the database, this example database that we're going to use. So let's input that data. So there's the person, the responses, and that's how it would be stored in the database. So every row would be a survey or a person. So every row represents somebody in there, except the header, because the header is going to be the questions on the survey, right? If you look at the bottom here, a survey ID would go here, and so on and so forth. And so it'll usually go in the order that the survey asks the questions, with exceptions, obviously. So let me know if you have any questions on that. But we can go into more detail in a little bit, and I'll show you, and it should start making more sense. So I'll do this here real quick. I like this. If you look at the screen, so the survey ID goes there, male goes there. They responded yes, so that gets inputted there. Cloverdale, that gets put there. Weight, height. So notice on height, this has to be a question that you guys ask yourself and with your group and your supervisors. How are we inputting data? For me, if someone puts 5'10", I'm just going to put 70 inches. So everything is going to be in inches. That might be more burden on you guys to do a conversion. It all depends. You can always do that later in the analysis, but I like to do pretty simple and standard. And so yes, they smoke. And so you're inputting it now. The data is getting entered. And then the next survey, the same thing happens with the next survey. Survey ID, age, gender, tribal affiliation, yes. Which tribe? Redding Rancheria. Weight, 140 pounds. Height, that's going to be 62 inches. Do you currently smoke cigarettes? No. And then the next survey, if they answered it, that's how it would look. And so you do this with every response you get. This is how you would manage it in your database. So data cleaning, we found an error here. If you look on the screen, that's 688 as an age. So something's wrong. So we would look at the survey ID, F1003, we'd go back and find that survey. And okay, that person's actually 68. So we would change that, right? What else is wrong? This is something that we start getting into these little issues, things you want to work out before data entry even occurs. Like you want to talk about scenarios that happen, what you're going to do in certain states. So this person said, no, they're not affiliated with a tribe or rancheria, but they answered the yes question. No, but live on Karuk Reservation. Now, me as a researcher, I'm entering this data, I'm trying to clean it. What would I do? So it's a bit of a situation to be in, because does that mean that they're Karuk, or they're living on the Karuk Reservation? Maybe maybe they understood it as, because I'm living on the Karuk Reservation, I can't be tribal affiliated with, but I'm from the Navajo Nation or what have you. We can't make assumptions when we're entering data. So what I would do is I would say no tribal affiliation, and I would put no response or no affiliation in the affiliation specify area, because I can't assume that they really meant yes. And those are some of the basic tenets that you have to follow. You have to have those protocols in place when you're doing your data management scenarios as they come up. There's always scenarios that come up even after, so it's okay. But as long as you get that group consensus, for me, I would ask my supervisor, I would ask my fellow epidemiologists, what would we do in this situation? And sometimes they would ask me. So the other arrow is, how much do you weigh without your shoes? So this person says, don't want to answer. That's okay. Sometimes people don't want to answer that question, and that's their right. We usually let them know if you feel uncomfortable with answering any questions, don't answer it. So they have that option, and so I would enter that as NA. And so make sure when you're entering the data that you're always including your responses the same way. So if something's not available, it's always NA, or it's always N-A, or whatever combination you want to use. Make sure it's always the same. So consistency, especially when you're housing the data and managing it, is very important. And we'll go into that a little bit more. So again, consistency is key. I can't stress that anymore. We'll talk about in a few slides how you will deal with some of those situations, with a little issue about reviewing some of the data as it comes up. So not only should it be consistent, but you should limit data entry errors by using a data dictionary. So data entry should be consistent, but it should also be consistent based on a data dictionary. That's something that you'll probably develop before you even collect your first respondent. You should always have a data dictionary, because you guys probably all know that you're not going to be the only one entering the data. Maybe at first you would, but if it was, the project's ongoing, so you're always collecting data. Maybe there's an account for turnover, so you want to make sure, if I'm not here, if someone's not here, that someone knows exactly how to enter this data. And that's why the data dictionary is so important. Multiple people entering the data can enter it multiple ways. Someone might say when they enter their data that NA should be not available spelled out. Just little things like that give you less of a headache later. And just making decisions early about how you'll handle those data situations. If needed, consult with your lead, your director, your supervisor, and come up with a consensus. As long as it's something that everyone can agree on, that's how you'll handle a situation. So let's go back to the data dictionary. What's wrong with this data dictionary, with this database, sorry. So if this was your database, you're doing it for your program to collect your data from your survey results, what would be the first thing that stands out to you? Julie, what do you think kind of looks wrong with this database?
Well, what I see, the first thing is the age. So instead of like 29, 45, 68, and then it has 40 years written out. Mm-hmm. And then it has 30 YRS old. Yeah. So it's not consistent. It's not the same across the board. Mm-hmm. So I would have a hard time reading this.
Mm-hmm. What else? Do you see any other errors across the board?
Everyone, okay, so age, I see 403. I see male and female aren't just M or F. It's all written out, some half and half. Affiliation, I see yes and no, but then I also see Y and N, so it's not consistent across the board. Mm-hmm. So I think it needs a lot of cleaning.
Yeah. And so for the age one where it says 403, what would you do to make sure you correct that?
Well, I would, from what you said, I would go back to the survey ID number and I would see what their actual age was. Mm-hmm. And then just clean it.
Yeah, so thanks. There's a lot of errors in here. I wouldn't say errors. There's a lot of inconsistency. Yeah. And consistency is key. So I'll highlight all the errors that I found. Maybe it's not all of them. Maybe it is. So you want to make sure that you're inputting age, always a number. If you're doing 40 years, it's always 40 years. 40 years old. Someone, like she pointed out, YN for affiliation instead of yes, no. If you look at affiliation, when they specify their affiliation, if you look up, you see Pitt River and Redding. One said Redding Rancheria and another said Pitt River Tribes. You want to, even in those responses, that might be an open-ended. Someone might write those two different things, but at least on our end, because we know our communities and some of the tribes, that we want to be inputting it correctly. If we're going to do one for one of them, we do it for all of them. Weight, 199 pounds, 108 spelled out. One spelled out in pounds, one's LBS, and another one's in kilograms. It's our job to manage the data to make sure we're storing it right in the unit. So the number is going to be 199, 108, and whatever the equivalent of 54 kilograms is. We're going to make sure, even if the person wrote 54 kilograms, we'd have to input it as pounds as a number. If you look at height, someone put 5-3, 6-0. Like I said, my decision here was to do it in inches. So I would specify that in my data dictionary, and whoever was entering this would know that not to put 5'3" or 6 foot, they would put the appropriate inches. And the last one is smoking. Someone put Y, so that should be yes. Little things. So you can see that data management is really largely about a lot of little things. Managing consistency is sort of the most important part. And it's definitely the most important part when we talk about analyzing the data, or having someone help you analyze the data, or share your results, or share your database. We're gonna look at one more thing on here. So see the arrow, it says Redding Rancheria. If you look at that row, the person said no for their affiliation, but it still says Redding Rancheria. So when I see that, I would think that should say no affiliation. So I'd pull up that survey, obviously, and make sure that, what we're talking about is consistent. And I would make sure all these corrections are made before we get too far along. Thankfully, we only have 20 responses. Maybe that's all we need. Maybe we're getting 1,000, but we want to correct those inconsistencies earlier. And if you look at the database now, you can see that it's consistent. And if you look at the Redding Rancheria example I gave you, row 8, it says no. I changed it to no affiliation because I went back and looked at that survey, and it said no. It said no, but I live on the Redding Rancheria, so I would still say no. I'm not going to assume that because they said Redding Rancheria that they live there. I'll change their affiliation to yes because they did say no. I can't make assumptions on my end. So I highlighted there to let you know where that was, and I changed it. So that's part of cleaning data and managing it, ensuring the quality is consistent. Going back to that, so I told you I went back to the survey, right? So if you look at the bottom, the survey ID, that's the one. I'm gonna pull it up, I'm gonna look at it, and or maybe the situation's like this. So are you affiliated? No. If yes, which tribe? They say enrolled in Redding Rancheria, but don't live there anymore. That's a different situation. I would actually, because you're not assuming now, you can actually in good faith say they're actually enrolled in Redding Ranch. So I can actually change their answer to yes, and then change their affiliation to Redding Rancheria because they have said that. And sometimes maybe the instrument doesn't make sense to the person, or there's some other issues, and you have to account for that. And that happens all the time. So if this was if this was a web link or taken on an iPad, if they pressed no, they never would have gotten the if yes question. That's good for a lot of situations, but for this situation, maybe not so good because now we miss someone who's actually affiliated with a tribe or rancheria. So it has its pros and cons, obviously. So here I'm gonna change it to yes and then keep, or here's a different situation actually. What if the person said that they're yes affiliated, but their answer was I'm not native, but my partner is native from the Redding Rancheria where we both live. What would you do in that situation, Julie? Do you consider that person affiliated with the tribe or rancheria?
Me personally, I would say no, because we needed to know the person who is actually affiliated with the rancheria. Mm-hmm. So I would say no. Yeah,
that's a good call. I would say no as well, just because the question might be confusing. Maybe now I'm seeing, to non-natives, maybe to non-natives who are with American Indians or live on American Indian land, it might be confusing. But I might keep it too, because I might think of the importance. So I'm trying to really get maybe a baseline measure of perceptions of American Indians. That might be the more important part. Whereas I just want the non-natives for comparative purposes. So if they get a little confused by that question, maybe I'm not as concerned as a researcher who knows this is more applicable to American Indian communities. So I would change the response to no, they're not native. That question is really meant to say, are you American Indian in a tribe or rancheria? I think a lot of native people would understand that inherently. Maybe a lot of non-natives wouldn't. So to me, I would make a judgment call that may not be the most important aspect of this survey for which we're getting. Again, so I talked about the data dictionary a little bit. So this is a simple data dictionary, how it might look. This is something for this survey, I would print out exactly this for someone. I would give everyone a copy or store it somewhere where we all have access to and say, If you're entering data, if you're collecting our survey responses and putting it in the database, make sure you're looking at this and following this, please. So it goes over some of the consistency that I talked about. The survey ID, the name, that's the survey ID, the description, it's the survey identification. The format's going to be F1001, 1002, and so on and so on. That's a character type. So the person who gets a new survey, what was the last one that was entered? Oh, F3000, that's 3001, 3002, or whatever format that is specified for your project. You would follow it. And so on and so forth with age, sex, affiliation, that's going to be age of participant, sex of participant, their tribal affiliation. The format that it follows, age follows the format of age in years, 23. Sex follows female, male. Depending on your survey needs, some people, might want to ask a transgender question. So they want to specify that in the data dictionary so people aren't, maybe someone crosses out male, female, and puts transgender, and you need a way to account for that. But if it's not accounted here, they won't know. So if I got a question and I was entering data and it said here, female, male, I would have to not answer that question because they didn't answer female or male. Or maybe they did answer it. So I would need something to follow consistently. And this lets people know that the affiliation is going to be open-ended. So those give you a little bit more of a headache when you have to think about consistency. But I for example, would always say, Pitt River Tribe or I would probably go to the tribal website and see how they prefer it to be spelled out, and I would always spell it out like that. If you look at weight in pounds, and if you look at height, I said height in centimeters. So that lets people know that we're doing conversion. And then in smoking status, yes, no, that's a character. It's actually categorical. You're either doing yes or no, but it depends on how you want people to see it. Sometimes simpler is better. Sometimes more information is better. If you have a big survey, your data dictionary would look much bigger. So this is for our survey. This is how ours would look. Obviously, if you have a long survey, we have long surveys, hundreds of questions. A data dictionary would be massive. So let's talk about. So we looked at this might be what your database looks like. The database that Julie had identified a lot of the inconsistencies and errors. It might look like that if you didn't have a data dictionary, because maybe these people weren't following a consistent plan to enter the data. This is how it might look with a data dictionary. So everyone knows. You'd still run into time after time, maybe someone accidentally enters, 300 years old. And that's why you have quality checks, making sure you're looking through. If it's a small database, you can just look and see, okay, no one's 300 or 400 years old. If it's a massive database, maybe doing a frequency of it or doing some quality checks of the data to make sure, that the answers can only be male, female, or between the ages of 0 and 180 or something, and it'll give you back the results of those that aren't. Who knows? It could be that complex, or it could be just looking up and down and making sure that it's consistent. So data management, keep survey data stored in a secure location. That's probably one of the more important parts, actually, because you want to make sure that you have access to it, but other people don't have access to it. Especially depending on the nature of the survey. Sensitive questions, information that could potentially identify people in a smaller community, things like that. That's very important. So ensure surveys have IDs in case follow-up is needed, like what we went over. There would be no way for us to identify some of those errors if we didn't have the surveys ID'd. Keep a data dictionary for multiple data entry people. That's going to be consistency across multiple people. Once all data is entered and any errors or logistics are finalized, keep a final data set. I would call it, final database, and that's something where it's housed maybe on a shared network where only you have access to, and then maybe you make a duplicate of it for your coworkers. Here, analyze this data, but they never get the final data set that you're keeping secure. You can always duplicate a survey, but once changes are made to it, it'd be very difficult to make put it back to its original state. You could take so much work than just to keep an original database somewhere and make copies for other people who are doing analyses. That's good practice once it's finalized. So one data set remains intact, and that's really for integrity purposes. And then you can really begin the analysis, the fun part. We'll go over that a lot more in the next webinar, part 3. And you'll see why a lot of this stuff that we went over is really important. for little things in the data analysis. That webinar will be more interactive. It'll be less presentations and more following along. So let's talk about some more considerations for managing data. So little things like use folders. So maybe, I know that sounds simple and I don't want to patronize anybody, but using folders is so important. A group file with folders, information that are particular to that topic. So maybe tobacco survey data focus group. That would be the name, or ACORNS evaluation September 2018. Something where it's consistent. It might sound simple, I know. I just thought I'd go over it. Also things to consider, are there existing company, organizational, or tribal procedures that you're actually supposed to follow when storing data? At CRIB, at CITE, we have guidelines and procedures and policies that we actually have to follow. A lot of them are federal guidelines for storing data, managing data, and destroying data. And those are things that we have to comply with. We have to have training that says we know how to comply with those regulations, because a lot of the survey data, a lot of the data we house is very sensitive, and we want to make sure, trained staff and competent and appropriate staff are managing that data. So it's always good to check with your company, your organization, or your tribe to make sure there's procedures in place for storing the data. If something went wrong, someone could say I was following the tribal policy or the organizational policy for storing data. Number one, done. Naming the folders, like I said, is very important for consistency. Structuring it, maybe you have your ACORNS project evaluations, and in there you have subfolders, evaluation cohort 1, cohort 2, you have different folders for which those data go. It could be different. I mean, it's really up to you, but structure is important. Keep ongoing and completed work separate. So if you have an ongoing project, like a database isn't complete, you would never store it in the same folder where there's a final data set. So keep ongoing and completed work separate. It's good practice to just keep it. We have this folder is for all the final databases that are good to analyze now. This other database is somewhere else. It's still being inputted. And some of the last recommendations I would give is back up your work if possible. If you could back up data, if you could back up, have a backup of your drive, of the data, some weird power outage happened and you lost all your data. I mean, thankfully you have your surveys to enter it again, but I'm sure nobody wants to enter, 800 or 600 surveys again. So yeah, review these details over as much as possible if needed. But more importantly, for review with your supervisor, with your colleagues, with people who can inform about what to do in these situations. That's more important than some of these other recommendations I give, because some people in your organization or your company or your program will probably know more about what to do in your situations than we would on this webinar. And again, just some final recommendations as we fly towards data analysis next week. Data analysis is really about reporting on data. It's really storytelling. Your story can only be as good as the data you collect. As Indian people, for example, as natural storytellers, we owe it to our communities to report appropriate data. We owe it to each other, to the communities we serve, to the broader Indian community, to report and account for the data appropriately. On paper, this may be words, but when managed properly, when taken care of, and when it's quality data, we can bring these stories to life. We can bring it to life with results, maybe because of your survey findings, because of your research. There's an intervention that's put in place. And that's something that goes a long way for people's lives. But at its basic value, data is a story. And again, I can't stress more that you can only tell as good of a story as the data you have. So if the data is really bad, like the database that we identified with all the errors, you couldn't still tell a complete story as we could with the database that people followed the data dictionary and the guidelines, and it was clean, it was quality, and so we could tell a good story. We can talk about the communities we serve, we can talk about the environment, we can talk about the policies and the systems that we're implementing, if they're working. We can talk about the health, and we can do that through data, numbers, and stories. So I just wanted to say thank you for participating, listening to me. If you're watching this recorded, feel free to let me know if you have any questions. I know it says Eugene's email on here. I left it at that since he started the webinar series. Or feel free to call us. Many of you have my email if you need help for things related to this webinar, and we will definitely keep going in this series.
One thing I'd like to say in regards to that is we did send out technical assistance forms. So if you would like to get in touch with Eugene or Michael, if you could fill out that technical assistance form and send that to me, and then I could get it sent out to each one of them. Something that's really important that Michael shared was for many of you, we're writing these new grants. So those are due to us September 4th. And data paints a picture. And that's why this series, this evaluation series, is so important to be attending, because each one of these is a building block to the next one. The data dictionary, many of us have talked about how we have consistent staff turnover. So when folks are coming on board and, with this data dictionary, it just paints a better picture. So it makes it easier when someone new is coming on, that they can just start and they can just jump right in and take these things over. So again, this is building blocks. So our next evaluation webinar is going to be August 16th. So what I'd like to do is I'm going to record this. I'm going to put it on our ACORNS, our Crib ACORNS website. I really want you guys to go back and review this. It's like a prerequisite to our next evaluation piece on the 16th. So I know that many of you are collecting surveys, and that's why it's also very important to get in touch with Michael, because you don't want to have questions that somebody's going to say, oh, hey, I know that was Julie because, they said, this, that, and the other on the survey, and that you could totally know that it was me or that it was Michael or Eugene. So, those are things that you can get in touch with Michael about. Again, please submit those TA requests. I would like to just go over again that our TA application webinars are going to be, the next one is going to be on the 15th. The following day is going to be our evaluation. Our next building block is going to be on the 16th. Then again on the 22nd, we'll have TA for the applications. The applications, the ACORN site applications, if you're confident and you feel like you're writing a great, strong application, you don't have to attend those. But the ones that I really want you to attend is the 16th and the 23rd. Those are our building blocks for our evaluation. And remember, those paint, our data that we collect paints a really important picture about our communities. So if you guys do have any more questions for Michael at all, if not, I'm going to go ahead and end this presentation. Please submit your TA request to me, jvia@crihb.org, or you can call me, 916-929-9761. I'm at extension 1512. This is going to be on our website. Thank you very much. Bye.